Hello and welcome everyone to Women's Health Tech Wednesday today. I am your host, Ansley Bowen. And before I get started and introduce our great guest for today, I wanted to run through a couple of quick announcements. We have our New York City Health Innovation Week coming up in May. Tickets are on sale now. You can scan the QR code and also there'll be a link in the chat. We also have our Breakthrough Alliance Challenge that is open to all innovators. So if you have an innovative solution, I encourage you to apply to win prizes. We are accepting applications until April 12th. Also, you can scan the QR code as well as click the link in the chat. We also have our Age Tech Collaborative Challenge by AARP, Age in Place Building Tomorrow's Smart Homes for Longevity. So if you would like to also apply to that pitch competition is in June. The applications are open. The link will be in the chat. And lastly, we have our March Symposium coming up next Thursday. Highly encourage you to also register for that QR code, or you can click the link in the chat. And without further ado, I would love to welcome our guest, Jennifer Celio Lee. She is the Senior Manager of Partnerships and Business Development at Samsung Health. Thank you so much, Jennifer, for being with us today.
Thank you, Ainsley, for having me.
And I wanted to start off by asking if you could please talk about your journey. What inspired you to pursue digital health and innovation? And most importantly, give the audience some background on yourself.
Sure. So I started off my career as an occupational therapist. I practiced for about 12 years. And while practicing occupational therapy, I also did some assistive technology evaluations. So I worked with children with developmental delays, some due to autism, cerebral palsy, attention deficit, and hyperactivity disorder. And the assistive technology would help them access their curriculum so that either if, for example, you have a learning disability, you're able to type out your notes as opposed to writing them. A lot of students struggle with the act of handwriting, so much so that it interferes with their ability to express themselves through writing. So using technologies like even very simple word processors at the time, I actually don't know what they're all using now, really enabled students to be able to complete their assignments and participate in class. So I always had an interest in using technology to enable people to kind of live their lives to the most independent that they can be.
Yeah.
So when I developed an interest in public health, I also was interested in technology. One of my projects during public health school was with the Department of Health, who at the time was enabling primary care providers in the city to adopt electronic health records. So using that made their record keeping a lot more efficient and also enabled data analysis to occur in ways that wasn't happening previously. So we use that for a quality improvement initiative. So from there, I kind of launched into a career in digital health, and I worked for a variety of startups before my role here at Samsung.
Well, that's great. And again, thank you so much for being here today. I always love to hear about people's background and I feel like it's never really a straight shot for most people. I feel like we kind of go into something that we think we are really interested in and perhaps we are, but then we also kind of veer off and kind of find a different career path for ourselves. So I always love to hear about why people are where they are today. And in terms of, were there any challenges that you encountered early in your career that maybe led you to where you are now and how did you overcome them?
Yeah, so one of the biggest things holding me back early on, I would say would be my lack of confidence, and especially when it came to public speaking. So even while in school, occupational therapy school, undergrad, I didn't really contribute in class, and it wasn't necessarily because I wasn't engaged. I was just afraid to speak up. So when I decided to make a career change and go back to school for public health, I decided that once and for all, I was going to really tackle my fear of public speaking. So the first thing I did, I enrolled in a public speaking class, and I'll never forget the first exercise. It was simply just to stand in front of the class for 1 minute without saying a word. And that was super uncomfortable. um, so that really like tuned me into, part of what my fear was. And that was just like, I was just uncomfortable,
Yeah.
standing in front of a group of people. So I took an acting class after that, and it was based on the Chekhov technique. Basically, you act out your emotions using physical gestures. And that got me more comfortable with losing some inhibition because you end up doing some really ridiculous, wild movements in front of other people.
Mhm.
So that was a really fun experience. And then from there, I just made it a goal to speak at least once in every class during public health school. And I think I achieved that goal. And I also was able to seize every opportunity I had to speak in front of my peers as a student. And then later on, it definitely helped my career in terms of being able to present in front of other people. And in fact,
Yeah.
getting on stage for the Hit Lab Summit, what's that was not not something in my comfort zone. But here I am, and even though I get nervous, I still go for it.
Yeah, absolutely. Well, I was about to say I could not tell that you had a fear of public speaking, especially after your presentation at the summit. So it's funny that you can take it from going back then to like really being scared of speaking in public to now you have a platform where you can speak and that you challenge yourself to do so. So I think that's great that you were able to kind of learn that skill also through other other ways, other classes in the traditional like public health or healthcare classes. So I love that. I love that. And talking about skills and qualities on your journey, what other skills or qualities do you believe have really been instrumental in your success to the healthcare industry?
So this probably goes without saying since I had a fear of public speaking, but I'm naturally an introvert. So
Mhm.
I think this makes me a good listener. So I usually let other people talk and then I synthesize everything I've learned from them. And when you work with patients or you work with customers, this is a very important skill to have because really all they want is to feel heard,
Yeah.
and to feel like, what they're saying is actually making an impact on what you deliver them. So
Mhm.
I think being a good listener and being an introvert is not necessarily,
Yeah, it's not
um,
necessarily a bad thing at
yeah,
all. No,
yeah.
it gives you that empathy and gives you that ability to listen and take a step back. And I think that's important because we definitely have to listen to everyone, that we are trying to make a difference in their lives. So I love that perspective a lot. And I also like to ask this question to a lot of people too. Was there any role models or mentors that played a significant role in shaping your career path? And if so, how did they inspire and guide you?
Yeah. So I actually took a leadership class in healthcare innovation. And ever since that, I've really been on the lookout for traits that I admire in leaders,
Mhm.
and I try to emulate them. So, for example, like some people are really good at setting the stage and getting their team aligned and encouraging true teamwork.
Mhm.
So it's something that, I like to think about and try to instill in sort of my everyday practice as a member of the partnerships team. And then there are, some people also have a strong work ethic. And so whenever I feel challenged and I feel like I'm never going to get something done, I
Mhm.
think of those people and I just keep chugging.
Aw, I love that. That's great. That's a like it's almost like a mentorship, but not really, completely hands-on. So I love that. It's nice to think about
Yeah,
others who've
it's like
had.
mentorship without their permission.
Yeah. Well, can you also discuss if there is any particularly a challenging project or initiative that you worked on early on in your career, and how you really navigated through those obstacles to achieve the success?
Yeah, so early on in my startup career, there was a point in the company where we realized that we were building the business around an incorrect assumption. This ended up disbanding the organization, and while that wasn't, exactly a success, I was definitely proud about the way I personally handled
Mhm.
the situation. There was a lot of scrambling, a lot of panic, and I really credit my meditation practice with allowing me to take a pause before reacting and before making a move. I think,
Mhm.
when when things like that happen in your career, a lot of people are just very reactive
Mhm.
because they feel like they have to do something. And I totally understand that. They feel like they have to do something immediately. Otherwise, people don't think they care but I literally had one of my team members relentlessly calling me during this time and, just taking a pause and taking some time to reflect allowed me, the time
Mhm.
to formulate some options, consider them carefully, and make some
Right.
decisions. Um, so, you know, I think that that applies to personal life as well. Just not trying not to react in that moment of panic.
Yeah, I was also gonna like when you were talking about that, I was gonna ask if how do you maintain that motivation when you're in those setbacks or difficulties and you've encountered in your career? How do you take, these hardships or setbacks and really just feel like, okay, what are the next steps? Where am I going to be resilient? What is my motivation? Do you think a part of that is because you take a step back first and then you can kind of see things clearly and kind of plan it out that way instead of just acting? I'm definitely curious to know how you maintain that.
Yeah, I think it's taking stock of the priority. Like what
Mhm.
what is the priority here? If it has something to do with working with a patient, so that becomes your priority and that becomes your North Star. So I think always just keeping whatever that goal is in mind, the ultimate goal,
Mhm.
and how we can minimize damage.
Right.
And obviously with the patient, that's that's clearly our goal. When it comes to kind of business decisions, minimizing that damage is also um, really what we should be focusing on.
Yeah. And as you talked about like your career path with digital health startups and that you had that experience in the past, how did that experience shape your approach to healthcare innovation that you use today?
Yeah. So when you work in a startup, and you're customer facing, you end up wearing many, many hats and you're close to everything that happens with the product. So anything from representing the voice of the customer to designing and executing implementation plans. So I suppose that I think very granularly in that I think of the individual users and how products would fit into their everyday lives. Like I really try to, take take their perspectives in mind, as opposed to maybe looking at the larger picture.
How also do you, see the intersection between occupational therapy and digital health also evolving in the future? I know that you mentioned that there's more hands-on related technology that you feel like is very useful for occupational therapy. But is there anything in specific that you see that's really going to help shape occupational therapy with digital health?
Yeah, so occupational therapy, for those that may not know, it enables individuals to achieve the greatest level of independence in their life roles and their daily activities. And so as digital health shifts towards the home, OT and OT like thinking ensures that there's a good fit between the digital health user and the technology, and that technology supports them in achieving their personal meaning, and whether that means being autonomous, or
Mhm.
maybe that means being a grandparent or a spouse. I think getting that good fit is always something that we need to address.
Yeah, absolutely. And I think it's super interesting. I feel like we all have had perhaps a different experience with occupational therapy. For example, I had to go to occupational therapy to help get movement back in my hand after an injury. It's so interesting to think how digital health can be so intertwined with all these different areas within health just by, creating a technology device or a solution that helps, with different physical therapy, occupational therapy. So I love how much digital health is just intersected within the whole healthcare world, really.
Yeah, and it should be. Yeah.
Exactly. And on the topic of women's health, of course, I wanted to ask, in your opinion, what are some of the most pressing issues that you think are facing women's health advocacy today?
Um, well, I guess you can't really talk about women's health these days without, thinking about reproductive rights. I mean,
Mhm.
it's in the news all the time, and there's a great fear that um, you know some of these reproductive rights that we've had um, will go away. And so
Mhm.
um, I think about my journey. I'm a parent of a young child, and I I went through IVF, and to think that women are prevented from making that choice, that they
Right.
want to have a child, and here's technology that can assist with that, and just not having access to it. And it just really uh, you know especially coming from a public health background, that's all we think about in public health is access to resources.
Mhm.
So yeah, that really hits me personally for sure.
Yeah, absolutely. And on a more positive note, what do you think are the most promising areas for innovation in women's health specifically?
Yeah, so early diagnosis and treatment,
Mhm.
um, and also just awareness of diseases that affect the reproductive system. Um, Endometriosis, for example, uterine fibroids,
Mhm.
PCOS. So many people, so many women suffer for so many years without even getting a diagnosis.
Right.
And I think there's a perception that that pain is just part of being a woman.
Yeah.
And that's really unfortunate. And some are driven to seek answers only when they're having difficulty conceiving, for example.
Right.
And at that point, it's like years and years and years. It could be 20 years or
Mhm.
more
Mhm.
of suffering and needless suffering. So I'm very encouraged to learn about different technologies that can help with
Yeah.
that. And that just having conversations about it, I think will bring that awareness to the forefront, and even to clinicians that may not be fully aware that these conditions exist.
Right.
Um, and then there's also, the diagnosis and treatment of chronic diseases, which, historically has been based on studies in the white male population.
Mhm.
So I'm excited for, progress in personalized medicine, which can begin to eliminate some of these antiquated standards of practice.
Yeah, yeah, absolutely. And we have a question from the audience that I wanted to
Mhm.
ask you. Do you see DNA genetic testing as part of the path to understanding predetermination of women's health disease diagnosis?
Yeah, absolutely. Let's see. Um, I guess talking a little bit more about my personal journey, yeah, I think my difficulty in conceiving could have been prevented,
Mhm.
or um, maybe diagnosed and realized a lot sooner with some
Yeah.
of those technologies. And then, and of course, intervention could have taken place a lot earlier.
Right.
So absolutely.
And kind of on a similar topic to that, how do you think that digital health started specifically can better address these unique needs that women have within women's health?
Yeah, so I think it's that access, going back to, public health.
Mhm.
It's creating access through technologies. It's creating awareness through technologies. If if I can have access, for example, to, telehealth, or
Mhm.
a way to record, both passively and actively record some of my symptoms. That is evidence that you could then bring to your clinician, either in person or on a telehealth visit,
Right.
that provides such a rich history, versus just reporting, a symptom.
Mhm.
You know, at least we can start to see some patterns. I think, that's some of the importance of digital health, um,
Yeah.
as well as support. I think the mental health, emotional support aspect, is another way that digital health can provide access.
Yeah, absolutely. And kind of on that same token, have you ever encountered any resistance to adopting these new technologies in healthcare, and how do you address it?
Yeah, so in one of my startups, I work very closely with clinicians to adopt new technologies. And when doing that, it's very important to understand their workflow. And this changes from setting to setting. So you can't just assume that in one hospital, this unit works that way, like the emergency room works in this fashion, and then at the next hospital work in the same way. So it's really important to sit down and really understand that. And then also understand that any hiccup to that established workflow represents an obstacle for that clinician. It represents a temporary slowdown, regardless of whether or not that technology's purpose is to create efficiencies.
Yeah.
So I think coming from a place of that understanding and not just imposing technology on folks is very helpful. And
Yeah.
so like there's a learning curve for anybody to adopt something new. So you want to think about like where's the easiest place to insert this new technology, and just really start with small wins.
And on that topic also of access, what do you feel like are some key considerations for ensuring that there is equitable access to these healthcare technologies, not just only in women's health, but in all aspects of healthcare?
Well, affordability. So
Mhm.
price is always a consideration. Who's paying for it? Is it the insurance company? Am I paying out of pocket? Um, so that that's probably one of the number one
Yeah.
considerations. And then if you need access to broadband and cellular service, that's another one. Like we don't want to just create technologies for folks that live in large cities.
Mhm.
We want it to reach every corner of the country.
Yeah.
Um, and then accommodating a variety of languages. We want to always be mindful that we're including other cultures,
Mhm.
um, other languages, and not just verbal languages, but like American Sign Language, for example.
Yes.
Um,
Yes.
and we want to accommodate a variety of abilities. So on that same note, just thinking about, we all use our smartphones to
Yep.
for apps, but how does that include folks with physical disabilities
Mhm.
or visual or auditory? So we want to make sure that it's accessible in those manners as well.
Yeah, absolutely. And kind of talking about that access, do you feel like the patient portals that we have now, or similar technologies to patient portals play a good role in improving healthcare outcomes, or do you think they can still have improvement?
So certainly they can have some improvement. I think it needs to be as user friendly as possible.
Mm.
Um, thinking also about older adults being able to access their personal health
Yeah.
records.
Mhm.
Um, so, you know, making it so that, the most important information is at the forefront, and that you're not necessarily like wading through lab results that you
Right.
do not know what it means. Um, yeah, so I think it's very empowering. At the same time, having access to your personal health records, you're able to make corrections because
Mhm.
you're relying on clinicians to input a lot of that data, and so maybe they've gotten it wrong, they didn't hear you correctly, so
Mhm.
it's an opportunity for that as well.
Yeah. And how do you feel like there you can properly balance the need for patient data access with also the privacy and security concerns with that?
Yeah, so I guess on a personal level,
Mhm.
I'm willing to take a certain amount of risk
Mhm.
if it means that my clinicians are, provided with the complete picture.
Right.
Um, on the business side, on the company side, I mean, that is a huge, huge consideration, and something that we put at the, top of our priority list. Once you have that data breach, it's really hard to rectify.
Hmm. Yeah, absolutely. But I think that, it's just there's always maybe a little bit of a risk, but hopefully the reward will always outweigh that risk. And I feel like if a lot more people, kind of have that mindset, then hopefully we would be able to address and increase access through technologies, such as, using smartphones or whatever that technology may be. But yeah, definitely. And looking back, on your 20 years of experience that you have, what are you most proud of accomplishing in your career in healthcare advocacy and innovation?
Um, I'm proud of every opportunity I've had to solve a problem, whether it's making a patient's life a little bit easier in just that moment, or making clinicians' life a little bit easier so that they can focus and enhance the care that they're providing to patients.
Mhm.
I, I don't, I really don't think about like big accomplishments. I like to appreciate those,
Oh,
everyday type wins.
yeah, no, I love that. I love that. And how are you staying informed about emerging trends and advancements in healthcare and technology?
Well, HitLab is one of them. Great source of information between all the emails I receive, the monthly symposiums, the summits, and all of the networking events in between. The more you put yourself out there, the more you learn from others. And I can't express how grateful I am for that opportunity to be able to learn from others. It's so valuable. And I also like to mention Lunch Club, which is basically it sets you up on these little 30 to 45-minute conversations. And when you have that amount of time to speak with someone, you get to go beyond the small talk, the where are you from and what do you do, and you really
Mhm.
uncover what makes you tick and what you found helpful along the way.
Yeah.
I love learning about what has worked for other people.
Yeah, yeah, absolutely. I love how you really have that perspective that you want to learn and take a step back and listen. Because I feel like, that is often a perspective, at least for myself personally, I kind of forget to do. I just kind of want to take action. So I love that, I feel like today is like reminding me, sometimes it's okay to just take a step back and just listen before having to act immediately. So I love that. And I know we're almost at time. Thank you again, Jennifer, so much for joining us today. But I have one last question.
Mhm.
As most of y'all know, Nina's our host for Women's Health Tech Wednesday. And so she always likes to ask this question. So in her honor, I'm going to ask this question until she is back. What advice would you give to your younger self as you embark on your personal journey in healthcare, innovation, and advocacy?
Um, yeah, so I would say I would have loved to get to know my professors and leaders that I admired on a personal level. Being the introvert, being not that aggressive, I didn't take the many opportunities I had to do that. So many people are so generous with their knowledge and their time, and they also remember when they were just starting out
Right.
themselves.
Mhm.
Learning from their experiences and different paths that they've taken to get them where they are today. And again, just talking to other people.
Yeah, taking the
Yeah.
opportunity when you have it and just going for it sometimes. Yeah, absolutely. Well, Jennifer, again, thank you so much. I feel like I learned a lot about your personal career and also just kind of like I said, I really feel like I'm going to take this with me through the rest of the day of like, you know what, I can just take a step back and I can listen and I can just, plan out things. I don't always have to act first. So I love that. And I hope to talk to you soon as well at our summit coming up in May as well also. But again, Jennifer, thank you so much for your time today.
Thank you. It's been fun.
And I just wanted to quickly remind everyone also that we have New York City Health Innovation Week coming up in May. We also have our Breakthrough Alliance Challenge. If you'd like to apply, applications will close April 12th. We also have our Age Tech Collaborative Challenge by AARP. Again, make sure you register for our March Symposium next Thursday. We will be covering the review of hymns and vibes as well as nutrition. Make sure you join us next week. You'll have one last chat with me for this month before Nina comes back. Thank you so much to our sponsors, FFF Enterprises and Goodwin. Thank you again to Jennifer for your time today and sharing all about your journey. It was great to speak with you. And thanks everyone in the audience for attending another Women's Health Tech Wednesday. I will see you next week and I hope you have a great rest of your day.